Hello, this is a virtual pathology specimen of Burkitt lymphoma of the small bowel. We are looking here at a segment of small bowel, and let's first orientate ourselves. The small bowel has been opened longitudinally, and what we are looking at here is into the mucosa. This is the wall of the small bowel, which is markedly expanded and thickened by tumor. And let me just turn this around. And we are looking here at the serosal surface of the small bowel, which is also very abnormal because we can see a very nodular appearance. Let me zoom in here. This is what the normal serosa should look like, which is very smooth. However, over here we can see that just beneath the serosa there are many nodules that are formed by the tumor, and these are protruding towards the serosa, causing a very irregular and nodular appearing serosa. There is no direct penetration of the serosa. We can see that the serosal layer is still intact. So let's have a look at the abnormal area, and the bowel wall we can see is variably thickened. For example, in this area it's not as thickened, and in this area it is quite thick. And over here it is markedly thickened, and it is replaced by this tumor mass, which is a pale tan mass. And we can see here again the appearance of the cut surface. And this is often described as similar to a fish flesh appearance grossly. So we have this very pale, relatively smooth looking cut surface, but there are also these paler areas here and here, as well as here and here, and these paler areas represent areas of necrosis of the tumor cells. Let's learn a bit more about Burkitt lymphoma of the small bowel. Burkitt lymphoma is an aggressive B-cell lymphoma. It is a non-Hodgkin lymphoma that is often associated with EBV infection, and in most cases there is constitutive activation of the proto-oncogene c-MYC due to a rearrangement, and this therefore promotes cell cycle progression. The commonest rearrangement is a translocation between chromosomes 8 and 14, where the IGH gene is juxtaposed to the c-MYC, therefore upregulating c-MYC. There are three epidemiologic subtypes of Burkitt lymphoma. There is the endemic subtype, which is found in Africa and Papua New Guinea, and usually this occurs in children in the location of the jaw. The sporadic subtype, which occurs in parts of Europe, America, and Asia, this occurs both in children and young adults, and the Burkitt lymphoma of the small bowel is usually sporadic. There is also an immunodeficiency-related subtype which occurs in HIV patients. Clinically, Burkitt lymphoma often affects extranodal sites, and we can see here this Burkitt lymphoma of the small bowel. This is usually associated with sporadic subtype of Burkitt lymphoma as well as immunodeficiency-associated Burkitt lymphoma. Usually, the patients will present with a very rapidly enlarging abdominal mass, which may be associated with abdominal pain. There may also be associated complications such as intussusception, giving rise to GI obstruction, and also GI bleeding, and sometimes even perforation. This tumor is actually a very rapidly growing and highly aggressive tumor. However, it is very sensitive to chemotherapy, hence it is potentially curable, and the survival rate can be as high as 90%, 5-year survival rate in children from higher socioeconomic status families. Grossly, there is an ill-defined pale tan or whitish mass with a fish flesh appearance that we saw earlier. This is actually the same case that we saw in the virtual pathology specimen, and this is the fresh specimen. We can see that the tumor appears almost whitish in color, and this is why it is called a fish flesh appearance, both the whitish color as well as its very smooth looking homogeneous texture. So we can see that the small bowel wall is variably thickened by the tumor. This annotated gross pathology picture, as well as the fully interactive virtual pathology specimen that I was showing earlier are available for free in Pathweb, which is our free online pathology resource. You can register for free and the link is in the video description. Microscopically, we will see sheets of monotonous, medium-sized lymphocytes invading the bowel wall. Here is the uninvolved bowel wall, and in this part, the tumor is actually present in the mucosa, just going into the submucosa. And over here, we can see marked expansion and thickening of the bowel wall with tumor involving the mucosa, the submucosa, and also the muscularis propria. There will be a separate video describing the microscopic features using a virtual microscopy slide, and that can also be found in Pathweb. When we look at higher magnification, we can see this starry sky appearance, where we can see these paler cells, which are larger, dotted throughout the tumor. These are tingible body macrophages. They are actually macrophages that are gobbling up dead tumor cells. Because this tumor is very aggressive, there is a very high turnover of tumor cells, and therefore there are lots of dead and apoptotic tumor cells, which are then eaten up by these macrophages. Hence, in summary, this is an example of Burkitt lymphoma of the small intestine, where the small bowel wall is markedly thickened by this very fleshy appearing pale tan tumor with some areas of necrosis. This fully interactive gross pathology specimen is found within Pathweb, which is our free online pathology resource. And as mentioned, when you scroll down, we can see additional information as well as annotated gross and microscopic pictures. Thank you.